Good morning. Today we're going to be talking about stroke as a silent emergency. There's so much going on and going around about stroke at the moment that I think it's important we clarify things because people don't know what's real and what isn't. Thank you, Dr. Alagbe and Dr. Hamid Ninalowo, for coming on the programs with me today. It's a pleasure to have you both with us, and it's an absolute pleasure to really be talking to you, Dr. Hamid, because of the recent successes you've been having. It's really quite exciting.
Thank you so much for having us again.
Okay. So, Dr. Alagbe, can we start with you? What's a stroke?
Stroke just simply means sudden blockage of blood flow to the brain or parts of the brain, thus leading to impaired supply of oxygen to that part of the brain, resulting in loss of function, the function of that part of the brain. What causes this blockage could be something that has actually been brewing inside the body, or we have just a sudden rupture of the blood vessels to the brain. That is what we call stroke.
Okay.
Oftentimes, there is something also that may impair blood flow to the brain, but may not cause a devastating diminution in function. We call that transient ischemic attack. I believe as we speak on, we're going to talk about the two types of stroke that we have based on what causes it.
Yes, I think what I wanted to talk about really is that there's just so much going around, on the internet, on social media. In fact, there's a particular clip that keeps going around and my mother keeps sending to me. In fact, she sent it to me twice. Is this real? Can I circulate it? What is real? What isn't real? People are confused. So think about being fast. What are the signs? Because we know, in fact, what is so exciting, in fact, maybe I can even actually just ask Dr. Ahmed to talk about his recent clip about the patient that he treated recently that has been making the rounds as well, before we go into the Be Fast. Can you share with us, Dr. Ahmed, what happened with that patient?
So yeah, interesting. So we started providing a service at the end of last year called mechanical thrombectomy, which is kind of the worldwide standard for the treatment of strokes now, especially patients that have large vessel occlusions. And what a large vessel occlusion means is basically one of the large vessels in the brain is blocked with clot and it's causing the stroke, right? For most of these patients, if you can get to the hospital fast enough, we can do this procedure called mechanical thrombectomy to go remove that blood clot and basically get you better and basically reverse the effects of your stroke. This particular
But
patient,
oh, sorry, before you go there, because we always talk about what happens when you can reverse. Tell them what would have been the effect of the stroke. So
correct.
what would
So
have happened if that nothing was done to that patient with that massive blockage?
okay, so very good. So this woman basically had, she was 42 years old. She already had complete paralysis of her left hand and her left leg and facial droop, right? And slurring of her speech, right? If we did not remove the clot in this woman, basically these effects will now be completely permanent. They will never go away, right? So for this lady, as I said, she was all the way in Enugu. And for us to perform this procedure, people have to understand that time is brain. And what does that mean? In order for you to reverse the effects of a stroke, you can only do it if you do it within a certain amount of time. Because every minute, about 2 million brain cells die when they don't have oxygen. So we typically want to do this procedure within 6 hours of a person developing this blood clot in the brain. In some people, we can extend the window for this to about 24 hours. So when you get a phone call from a patient who is all the way in Enugu, about 12 hours after she's had a stroke and say, I've had a stroke, basically you have no hope for a patient like that. However, due to the resilience of the patient and her family, they drove all the way from Enugu to Lagos overnight. We took her directly to the procedure on arrival to the hospital about 10 a.m. the next morning, which was now about 32 hours since she's had the stroke. But most importantly, we had the imaging tools to make a decision, meaning we had a CT scan available to get a CT scan to see how much brain damage had already been done. We had a test called a CT angiogram also to see if there was truly a blockage of a large vessel. And with these two tools, we were able to make a decision to take her to the cath lab and remove the clot in the brain. And just 2 hours after removing the clot, she was able to move her hand and her legs. And a week later, she's walking around like a normal person. So for her, that's a significant difference in what would have happened to her.
Fantastic. And you see the age, 42. That's a young person, really.
Correct.
So it's really important that, that function was restored. So that's really fantastic. So thank you very much. I mean, Dr. Ninalowo, that's Dr. Hamid. This is what we really, really need in this country. Brand new technology that's going to move us forward. So if I can go back to you, Dr. Alagbe, that was phenomenal. What, Dr. Hamid has done and what his team here and his team are working on and providing that specific service. But people need to know, well, how do they know a stroke is taking place? As he said, time is brain. We keep on talking about mnemonics and so on. So can you describe how people can know a stroke is taking place within themselves, within somebody they're watching? How can they figure it out so they can act fast and get themselves or their relatives to a place that they can get this kind of treatment since it's available in Nigeria now?
Yes, ma'am. You said it. Fast. Fast, fast, fast. It's an acronym that stands for FAST. Check the person's face. It will reflect in the symmetry of the individual's face. You will see a deviation of the jaw or the face to one side, indicating paralysis of that face. A, check the person's arm. Tell them to raise their arms. You will see inability to raise one arm or the drooling of, the dropping of that hand down upon raising. Speech, listen to them talk. You will hear a slurry, blurry speech. And if possible, if you can look at their tongue, you see the deviation also of the tongue. We talked about time. That's the T. The time, we need to know the time all these things starts and how fast it is or what time limit they have to get to the hospital to get these things taken care of as soon as possible, as Dr. Ninalowo just mentioned.
Thank you. So fast. We need to bear that in mind. We need to think fast. We need to act fast because the quicker we sort this problem out, the better. But Dr. Hamid, it's not every hospital that can do this. And, we need to know from you, is it only where you work that can do this? Because you are the only interventional radiologist that I know in Nigeria.
So I think it's important to know that there are several treatments available for stroke and not just mechanical thrombectomy, right? So one of the major treatments we've had for a very long time in Nigeria for stroke is something called systemic thrombolysis, right? When with systemic thrombolysis, you don't need anyone with significant special skills. What you need is a neurologist or somebody that's knowledgeable enough in diagnosing a stroke and knowing what time interval it takes to administer this medication and understand the contraindications to administering this medication, right? But most importantly, you can only get this medication in really tertiary care centers in Nigeria, on hospitals that have stroke care, meaning a hospital that has the diagnostic capability of taking care of a stroke patient or evaluating a stroke patient, meaning they have a CT scanner in the hospital. You cannot go to a hospital who then sends you out to a diagnostic center to get a CT scan done and come back when you have a stroke. You've already lost the time window in order to do systemic thrombolysis in that period of time. And systemic thrombolysis can only be done within 4.5 hours of you having the first symptoms. So, imagine when your family member has a stroke or symptoms of a stroke, you have 4.5 hours of doing everything you need to do in order to make sure that they can get this medication, which can completely be life-changing. Now, if you cannot get that medication or you have a large vessel occlusion, that's where people like me come in, which is where we need special skills. And we call ourselves like the special forces of medicine, because we can use very advanced techniques to find our way through the body without opening up the brain or without surgery to get to that clot and remove the clot actively in order to restore blood flow back to that brain. And if you can restore blood flow back to the brain, then you could restore oxygen back to the brain and regain function. But again, even with what I do, we only have about 24 hours in most people to be able to do that for it to make sense. But even when I say 24 hours, it's very important that if you do the procedure, it's very important to know that if you do the procedure on a person within 3 hours of having a stroke, it's better to do that than doing it in 18 hours or 19 hours. The person who gets a procedure done in 3 hours gets a much better result than the person that gets it in 24 hours. So it's very important to understand that time is brain. When you have a person who has symptoms of a stroke, you need to present to a stroke center, a place with stroke capabilities, and look for the best expertise possible within your space.
Just to check that, is that only a CT? What if the hospital has an MRI? Is that just as good or?
So good question. So in most cases, the first thing we need to know when a person presents with stroke symptoms are, do you have something called an ischemic stroke or a hemorrhagic stroke? And what does that mean essentially? Do you have blood within your brain, right? An MRI is a test that takes a much longer time. A CT scan can be done within 2 minutes. An MRI of the brain will be done in about 20 minutes. They can give the same information, but remember, an MRI is also in a person who is already had a stroke. Everybody is nervous and anxious. It's very difficult for that person to lie still and get an MRI for 20 minutes. So a CT scan is the optimal test in those situations.
Wow. Thank you. Thank you very much. Well, that has been a very, very insightful few minutes. So I can just go back to you, Dr. Alagbe. Can you tell us about the risk factors?
Very good.
What makes a person have a stroke?
Very good. I often tell people it's about what you take into your body and how you take care of your body. What do I mean by what you take into your body? What do you eat? High cholesterol diet is not a good guy. Drug intake is number one culprit. I usually tell people to reduce alcohol intake. That's about what you take in. What about how you take care of your body? Well, nobody can prevent having a genetic predisposition to diabetes, to hypertension or hypercholesterolemia. But I always tell people, especially elderly men and women, to make it a matter of compulsion to check their body periodically. Just basic lab tests of your cholesterol level, periodic checking of your blood pressure, and if you've been diagnosed with diabetes, making conscious effort to make sure your blood sugar is under control. These are the culprit when it comes to a stroke. What you put in and how you take care of your body. It's very important. This is what makes the difference between when you talk about life expectancy in the advanced world and in Nigeria. Over there, people take their time to check all those things before it becomes a big problem.
Yeah, we don't do enough.
We don't do enough.
And even when people have some of these conditions, they don't do what they need to do. In fact, I was going to ask you about what do you need to do to reduce your risk in terms of, you're talking about food, exercise, but even the denial. People stop taking their drugs, they go to church, they've been told they've been healed, and they throw everything away. So, I don't know. It's a huge issue. So what do you want to do to encourage people? Because also a lot of people still think, they call, stroke a spiritual attack. No, you're laughing. It's true.
Yeah,
A
you're
number
very
of people will
correct.
still say my enemies have been at work, etc., and we don't take responsibility.
Pamela, and that's why I really, really, really applaud this type of program you are doing to educate people. I do some volunteer works whereby we go monitoring people's vital signs. And my dear, what I see mostly are dead men, dead women walking. You will see people with blood pressure of stroke range, and they're still looking healthy and everything. You know, there is need for us to talk about this more often. You were talking about stroke week or no stroke week. I'm not so good at it, but this is a topic uh, I don't think we need to have a week or a day for it. It is something that we need to talk about every time, and to actually provide avenues by which people can have access to monitoring of this blood factors.
It's actually interesting you should say that we need this monitoring, but I think what we need to talk about, and I don't know, Dr. Ahmed, if you want to talk a bit about the issues, about how people can reduce their risks of getting stroke, because you see the end result. And but there's so many people sort of in between. And we need to talk about it so that we find a way of getting through to people and letting them take responsibility for their lives.
Yeah, absolutely. I mean, one of the things, Dr. Alagbe talked about already is high blood pressure. High blood pressure is one of the biggest silent killers in Nigeria and can cause both ischemic and hemorrhagic strokes, right? We talked about cholesterol, making sure you're eating right, you're checking your cholesterol, you're getting on cholesterol modifying medications such as statins when you have high cholesterol and exercising appropriately. One of the biggest culprits that I see in this environment is smoking, right?
Mm-hmm.
Interestingly, we actually don't smoke a lot in Nigeria, which is a very good thing for us. But enough people still smoke, and smoking is probably one of the worst things anyone could do to themselves. Smoking causes strokes, smoking causes heart attacks, smoking causes peripheral vascular disease. Basically, smoking destroys your vessels and causes your vessels to narrow down and block everywhere else in your body, right? So smoking is one of those risk factors that most people can get rid of, but it's a bad habit that a lot of people have. But essentially, having a regular physical exam with a doctor who is checking your cholesterol, your blood sugar, your blood pressure is very important in modifying your risk factors.
When you talk about that, having a family doctor, I'd also want to put in, it's actually important. When I say family doctor, you want to call him a GP, what if you want to call that doctor the one that holds you all together? Because we also have a problem in our society. And I'm seeing a doctor for this, but the doctor I'm seeing for diabetes doesn't know I'm seeing the other doctor for heart disease. That doctor has no idea that somebody is seeing me for gout, which is maybe a result of one of the medications I'm taking. And I just keep all of them separate. But abroad, we have the family doctor, we have the GP that actually holds all our treatments and is the person that we come home to, as it were, and manages all in totality. But here, that doesn't seem to happen. I don't know. What's your experience and what's your advice to people?
Mm-hmm.
Oh, no, you're very correct in that, Nigeria is a place where, there's a lot of disconnection in the healthcare system. And sometimes the patients, I would have to say, do this by design, where they see different doctors for different reasons. And they don't even tell one doctor that they've seen the other doctor, right? But what we're used to, is basically a family doctor, as you said, who basically only refers you out to a specialist when you need a specialist to do something. But that family doctor is the person who takes care of you as a wholesome person. And it's very important for for everyone to have that doctor who's a GP or family doctor that brings everything together and then refers you out when they need to refer you out to a specialist.
Oh, thank you. So let's talk about rehabilitation, because you've talked about the acute treatment which is provided, but how important is rehabilitation after a stroke? And where should people go if they need it?
Okay. I want to believe you asking me this question. Rehabilitation is extremely important, but is often neglected because oftentimes when the trauma is over, we've forgotten the psychological burden that that person has gone through. Apart from stroke affecting some vital areas in the brain that controls behavior, and so the fact that a lot of these people are not exposed to psychological care as a form of rehabilitation is not really acceptable. Some actually have fulminant psychiatric illnesses as a result of this. Yes, we do a good job in getting them to the physiotherapist. And again, let me say this quickly, just to warn people. People don't know the difference between a physiotherapist and a fitness guru. That should be made known to them in order to provide complete care. They need to see a physiotherapist and not a fitness guru. Other things, people during that time have lost a lot of things. This is now where the social work now comes in, which we don't have very good of a provision of in Nigeria. And of course, we have a big families. So we should look at these people and their care after the initial phase as all encompassing, involving the psychologists, the psychiatrists, the social workers, if they are available, and family members, as much as they can add to the whole treatment modality.
You won't believe this, that we only have like 2 minutes left to the program. So do you have any last words before I go to Dr. Hamid to end the program for our listeners? Dr. Alagbe? Any last words?
Well, Pamela, once again, I want to thank you for providing this type of education for the populace. I'm so happy to be on the same platform with Dr. Ninalowo. I would call him a friend. I always take his post and disseminate. I want to thank you for bringing this advanced technology to Nigeria. I want to also applaud the fact that I like to train people who can do hands-on on what you are doing. I really applaud you and I really appreciate it. Once again, thank you. We can make it. We can make it if we keep talking about these problems over and over and over again. Right?
Thanks. Yes. Thank you very much. Dr. Hamid, your last words, please.
Yeah, so I think the biggest thing is to understand the symptoms of a stroke, be fast, right? Facial drooping, basically weakness of your arms, speech problems, and know that time is so important. Time is brain. That's the biggest message from this. And understand that not every center is equipped to take care of a stroke patient. You need to find centers, and everybody, essentially, I think this is the biggest thing I would say. Find a hospital that's close to your house that has a CT scanner and has capabilities to diagnose a stroke, so that when your family member does have a stroke in the future, you know where to go. That's the most important part of this.
Thank you. Thank you so much. Thank you for coming on the program. Thank you, Dr. Alagbe, for being on the program.
Thank you.
We appreciate both of you, and we hope that people are taking away the critical messages from this program. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.